pleased to be joined here today by our partners from the AAMDS International Foundation, Cancer Support Community, MDS Foundation, and the Leukemia Lymphoma Society for an informative discussion in support of the MDS community. I appreciate you all for being here and representing your organizations for the first time in this capacity to collaborate, to offer valuable information to support the MDS community during this time. Welcome, Claire, Dr. Nichols, Dr. Sekaras, and Tracy. Thank you for joining. Today's discussion centers around the challenges MDS patients and their loved ones have during the highs and lows of the pandemic of COVID-19 and how to better navigate this new reality. As the world continues to adjust to COVID-19 with restrictions lifting in some areas, this remains an important topic for us. The COVID-19 pandemic has affected patients in a multitude of ways, from diagnosis and treatment delays to physical and emotional isolation. And patients living with MDS are no strangers to these challenges. Now, we're gonna start with brief introductions.
Hi, Claire Saxton, Vice President of Cancer Support Community.
Hello, I'm Gwen Nichols, the Chief Medical Officer of the Leukemia and Lymphoma Society.
Hi, everybody. I'm Mikhail Sekaras. I'm Chair of the Medical Advisory Board of the Aplastic Anemia and MDS International Foundation and Chief of Hematology at the Sylvester Cancer Center at University of Miami.
Hi, I'm Tracy Iraga. I'm the Executive Director of the MDS Foundation.
Thank you, everyone. Happy to have you here. We know that many MDS patients faced challenges with managing their disease in ordinary times, and COVID-19 has presented new challenges for these patients. Starting with Claire and Tracy, what have you learned about life as an MDS patient during the length of the pandemic?
Early on, we did some studies, and we found that right away, patients weren't experiencing as many delays as we originally thought that they would. So the concern at the beginning wasn't very much different. Patients were used to isolating, they were used to having a compromised immune system, but that quickly escalated. And we found that the feelings that MDS patients had, the fear of death, the isolation, everything was heightened. Everything just became stronger and harder as the pandemic continued. And we found the significantly increased emotional issues with anxiety and stress. MDS patients in general are already fearing death and fearing, losing that special time with their family. Once they were told to isolate away from family and from friends, that became so much worse. In general, everything just became harder.
Thank you. Now, Claire, we'll move on to your response.
Cancer Support Community surveyed cancer survivors, half in active treatment and half who weren't in treatment, to see how COVID affected them in 4 waves of surveys over the first 2 years of the pandemic. And almost 150 of those cancer patients surveyed were blood cancer patients. And what we found was that it was perfectly normal for blood cancer patients to have experienced changes in their treatment and to also have experienced increased concerns, anxiety, and depression as a result of COVID. We had blood cancer patients reporting increased depression and anxiety compared to their levels before COVID-19. But then again, so did the general population. The more the pandemic impacted a person's life, so if they had increasing financial insecurity, increasing social isolation, or the increasing inability to secure basic needs, the more likely patients were to experience anxiety and depression. We also saw feelings of hope decrease with the pandemic. And again, this didn't only happen with the cancer community, but hope is an important source of comfort for cancer survivors. So our big takeaway was to know that it was really normal to need more support and more resources as a result of COVID. And it still is, even as mask mandates have been eliminated across the country. We've heard from patients that those changes have increased their concerns about getting sick. So if you're concerned about your health, concerned about the health of a loved one, concerned about other people's lack of adherence to safety precautions, you're not alone. It's really normal to have those kinds of fears and concerns. And it's also really normal to be more irritable, lonely, anxious, or depressed.
Thank you, Claire and Tracy. That was very insightful. And before we move on, Dr. Nichols, did you have anything else to add?
Well, I'd just like to say that I think cancer treatment centers moved very quickly, and I think Tracy was mentioning this, to adapt to be able to help patients get their treatment safely. So we didn't see the huge delays we were anticipating. But that being said, it means people were getting their treatment without their support person with them, because many people had to go into treatment alone. And so all the feelings that Claire and Tracy mentioned about isolation were heightened because you didn't have your support person with you.
I think you've all summarized this beautifully. When COVID first hit, one of my patients who had myelodysplastic syndromes commented to me, gee, it's like the whole country has MDS now. And what he meant by that is that he was used to wearing a mask in public, and he was used to this vigilance around surfaces and everything that you touch, and staying away from people who are sick. And now the whole country was engaging in that. So what I found in my patients, absolutely, there was increased anxiety for all of us as COVID hit and living through this, not to mention the effects of the isolation and the challenges in getting treated when you couldn't have your support person with you, your partner with you. But what I found is that my patients adapted to it beautifully because they were so used to it. And now I really share the comment that was just made about how now that states are dropping their mask mandate, and gee, they're even talking about it at the federal level in airports and on airplanes, that my patients are getting a little more nervous. And my advice to patients would be, don't let your guard down. Keep doing what you're doing. I am. When I'm in an indoor place, I'm wearing a mask. I still haven't eaten in an indoor restaurant. Continue to wear your masks. Continue to be vigilant about surfaces, though we learned that wasn't as important as we first thought it was, because there are going to be additional variants that are coming out. And in fact, the Omicron B2 is already becoming predominant in most states in the US.
How would you advise patients to lower their risk of contracting COVID-19? And how can patients be prepared to manage the disease with the emergence of new variants?
We have at LLS started a phrase that we'd like to catch on around the United States, and that is respect and protect. And that is, we should respect that there are still people who are at risk, as many of us are fortunate enough to be able to get out a little bit more, to lower our guard a little bit. There are still people who are at risk of getting very sick from COVID, and we should respect that people may want to wear a mask, may want to continue to social isolate.
Thank you. Respect and protect. I love it. I think I'm gonna borrow that.
Please do.
The other piece of advice I want to give people is, we give a lot of advice about protecting your physical being. I'd like you to think also about your mental well-being. And there was a survey that was done by the Aplastic Anemia and MDS Foundation that looked at a mood of caregivers and patients. Isn't that interesting? So thinking not just of patients, but the people who are caring for them. And what that survey found is that 30% of patients and almost 50% of caregivers experienced a worse mood during COVID, with heightened anxiety or worry in 36%, and from social isolation in 30%. So as you're protecting your physical being, I really urge you to think about ways that you can get through this pandemic and minimize the amount of isolation. And there are safe ways to do that.
What do you recommend MDS patients do if they're looking for more information on vaccinations and boosters?
Well, thank you for asking that, Adiola. The LLS.org has an updated list of information about COVID, about vaccines, about boosters. this information is so confusing and so changing. And if you go to lls.org, we keep this up to date on really almost a daily basis. We're changing the recommendations as they come out. And we have it in a number of different formats. So it can be printed, there are graphs, there are one-pagers, and then there's a lot of text. If you really want to read about it, we've got lots of info.
And now we'll pivot a little bit into, like patient advocacy and being drivers in their own care. So this question, I will start with Claire. So how can patient living with MDS and their loved ones feel prepared to advocate for themselves during these times?
Sure. I think one of the things to do is to recognize that the science isn't completely figured out. And so keep asking questions, because what your doctors know now may change over time as scientists and researchers are able to learn more. So keep asking questions. And another thing to know is if you do start to get sick, get in touch with your doctor right away so that you can get tested and potentially qualify to get one of the current treatments that need to be administered very soon after you get sick to reduce the risk of you getting severe disease. But just know that as we've seen throughout as we get more information, the doctors know more, and so keep asking questions and know that information could change over time, and that you're getting the best information that they have at that moment.
So I echo, of course, what Claire is saying. I think one of our jobs as patient advocates, and the most important one, is to empower patients to speak for themselves. And that's no different with COVID. It actually has been enhanced with COVID. So it's definitely, don't be shy, speak up. And not just about your physical well-being, but as others have mentioned, about your emotional well-being. Make sure that you're seeking that emotional support too. There's a full healthcare team available to you of social workers and psycho-oncologists that can really help with all of the different areas, of difficulty that we're experiencing now. We've got patient liaisons and patient support people. Call the counselors, use the hotlines, make sure that everything you're feeling is being addressed. Don't just try to live with it. We're here to help you.
In a lot of situations, people do everything they can, but still test positive for COVID. How would you advise an MDS patient who has tested positive for COVID-19?
Yeah, that's a great question. And that does happen. And that has happened to patients of mine, despite their incredible vigilance. It happens, because particularly with the variant that's as contagious as Omicron is. Very first thing we do, of course, is assess how sick they are. If my patients are relatively well and just happen to have test positive, and maybe that's because we were doing routine testing before the hospital admission or before a visit to the clinic, we ask them to stay home if they can. And we have mechanisms in place at the Sylvester Cancer Center for treating COVID patients in the infusion unit when they do need blood and platelet transfusions. But it is important to inform your healthcare providers if you do test positive so they can put those safety measures into place.
Are there any other challenges that MDS patients and their caregivers have been experiencing that we haven't covered yet?
So for me, I think the one thing that we didn't mention yet was the delay in diagnosis of MDS. I think that was a big concern early on, as patients weren't getting their routine checkups. So we were maybe losing out on some earlier diagnosis, which could mean, addressing earlier treatments. That was important. I think patients still are some are a little reserved and worried about going out to doctor appointments, and maybe that's still a concern, something that we should encourage people to maintain the routine checkups too.
Right. At Cancer Support Community, in our survey, we heard about 5% of blood cancer patients said that they experienced some delays in getting their treatment, and especially early on, about 4% believed that they experienced delays in getting that diagnosis. But 40% said that they experienced some kind of disruption in their cancer care especially early on. And then we saw 75%, so 3 out of 4 blood cancer patients using telehealth, which was not widely available before COVID, and using it both for telehealth visits as well as telemental health visits.
That actually takes us into the next area. We know there have been many challenges, but one of the things that COVID has accelerated is the use of technology, telehealth. So, and the community has found ways to adapt to help patients that may last beyond the pandemic. For example, Dr. Sekres, it appears there's an increase in telehealth. Claire alluded to it earlier. As a result, this is a direct result of the pandemic, and it has changed the way some patients are able to see their physicians. Do you anticipate telehealth will remain a primary channel for MDS patients and the way they communicate with their care team?
Right now, we're able to have a telehealth visit. It's the same as an in-person visit. And, I've noticed the phenomenon. I've been consulting with patients who are not in my immediate area. So people are coming for second opinions via telehealth as well, which is really a marvelous opportunity for a rare diagnosis like myelodysplastic syndromes to go and seek out a person who does have a dedicated clinical and research interest in it. What I anticipate in the future is that we'll continue to use telehealth, but probably as a hybrid with seeing people face to face, so we can really get a full picture of how someone is coping with his or her diagnosis.
So, Dr. Nichols, is there anything you'd like to add to that?
Oh, there are 2 things. One is I'd like to tell you that LLS is actively lobbying for the content. I'm sure my partners on this in the advocacy world are actively lobbying for this to be covered, because it really is a wonderful way to democratize ability to see experts and get information by coverage of telehealth. The other thing that I think the information change from COVID, trying to find a silver lining in an otherwise pretty miserable situation, is that many of our educational programs we did locally. And now we offer it both locally and online. And it allows people who don't live in the big cities or where there's an LLS office or where there's a big cancer center to get the information and educational materials at their convenience in their home safely. And so I think there's a lot to be said for finding the right hybrid of in-person and online that will change forever how we do medicine.
Thank you. I love thinking about telehealth in terms of access and, democratizing healthcare.
Right.
I
One
hope
of the
so.
things that we have seen, and one of the reasons why LLS and cancer support community and our other advocacy groups are lobbying on this issue, is because we have seen some of the flexibility in telehealth reduced. And so being able to access doctors across state lines doesn't always work depending on what state you're in and depending on what your coverage is. And so that's one thing that we really want to address, because it can be a really powerful tool. And, we would hope that it's, not the only tool, that we do get patients in to see their providers on a regular basis, but that not every visit has to be telehealth.
There was a recent study that I was reading that caregivers feel more comfortable knowing that their patients have the ability to have those telehealth appointments, and it adds to their feeling of safety for their patients. So I do think that, trying to get into a doctor or trying to get into those appointments, maybe it's a little easier through telehealth, or more frequent if possible. So they feel like there are ways we're learning now that you can monitor a patient from home. There's no replacement for seeing your patient in person and getting that feel for them, but at least there's a little something to knowing you can monitor a patient from home if we have to.
I'm hoping this will help us with clinical trials as well, that we can find a way to have fewer in-person visits in order for a patient to participate in a clinical trial. This speaks to what Tracy was talking about, that caregivers, feel the burden of the visits that the patient needs to make. And, it becomes, in this time when everyone is financially stressed and socially stressed, to ask people to take time off of work or a caregiver to take time off of work becomes incredibly difficult. And so I'm hopeful that telehealth will also help us in the clinical trial space to allow more people to take advantage of the new therapies that are being explored in the context of clinical trials. Many people can't because it's just too far away and too many trips and too hard on their loved ones.
I love that you said that, Dr. Nichols. I will tell you, we've pivoted to allow people to consent to enroll in clinical trials through telehealth and put the appropriate regulatory things into place so that that can happen. Right. We're seeing more trials allow remote visits as well, instead of the in-person visits when someone is otherwise healthy and it's just a symptom check. I 100% agree. That could be the silver lining from all of this, is it allows us to offer clinical trials to more people and minimize the burden on patients and caregivers in participating in them.
Your organizations have been essential for patients looking for resources and information throughout the pandemic. What support is currently available to the MDS community to help navigate the impact of the last few years?
Virtual events are definitely here to stay. We all pivoted to these virtual events as soon as we had to. They definitely don't replace the in-person patient events. And I think that our patients are showing that they miss those. They miss that interaction. We're trying to think outside the box and see how we can get patients from all over the world to feel that warm, fuzzy feeling they feel in person electronically if possible, but definitely a healthy balance of both moving forward. We have multiple online resources. We have animated videos explaining all of the MDS. We have printed resources, obviously, because our patient population is an aging population. We have everything available in print as well. So you have to make sure that you're covering all the bases, but our website has a wealth of information, as many of my colleagues as well. And you have to make sure you're meeting people where they are. So whether it's a mobile app or it's a printed piece or it's a video or a webinar, you need to have everything that all different types of people use to learn and to absorb information. So I think there's no limit to the resources that we can continue to come up with and use, and none of them will be obsolete. They'll all be usable in the future.
I too think that all of the advocacy groups represented here have wonderful resources for patients, and you ought to, if you're online, go to all of them. LLS has a group of what we call information specialists. Our Information Resource Center, this is a free 1-800 number. It is master's level social workers and health educators who have expertise in blood cancers, including MDS. And they have a wealth of information, as Tracy said, all in whatever way you like to take it, podcasts, printed, online. If you want it, we've got it. But we also have the ability to carry on a conversation, link you out to other resources, including the other groups that are here, financial assistance, copay assistance, support groups, local support groups. So, questions about COVID is just, the tip of the iceberg in terms of all the things that we can help you find. And this is also available for caregivers and family members, not just patients themselves, because as we've all said during this conversation, the caregivers often are the forgotten heroes of care for patients with myelodysplastic syndrome.
Again, I'll echo what my colleagues here have said, that contacting any of these organizations can help you get the resources that you need. If cancer support community, which is my organization, doesn't have it, we will refer you to the organizations that do have what you need. At Cancer Support Community, we have a cancer support helpline. It was actually increased in staffing as a result of COVID because we were getting so many more calls. We also have 175 Cancer Support Community and Builders Club locations across the country where you can get support and information. And I would be remiss if I didn't mention that Cancer Support Community has the Cancer Experience Registry that we just launched for MDS in fall of 2021. And this is a survey that patients and caregivers can take that helps us to uncover the emotional, the physical, the practical, and the financial impact of cancer. And sharing something about your journey through this can help thousands and help you join thousands of others in helping to add the cancer patient and caregiver perspective to influencing healthcare policies, to enhancing cancer care, and to improving the supportive services that we all offer, looking at the results of everyone coming together and talking about that. And that's available at cancerexperienceregistry.org.
I want to applaud everything everyone is offering to patients. And you've heard about some marvelous resources at the MDS Foundation, Leukemia Lymphoma Society. And we're fortunate to have, it's almost an embarrassment of wealth of resources that patients can turn to for a very rare diagnosis. At Aplastic Anemia and MDS Foundation, we've posted a bunch of webinars specifically about updated COVID-19 guidelines and addressing the impact of COVID on MDS treatment. We also have joined the rest of the world in giving virtual seminars. There are virtual support groups and patient forums, and there's an MDS toolkit to help patients at any stage of their MDS journey to understand their diagnosis and help with questions to ask somebody you're sitting in front of at the very beginning, and make sure you're getting the right advice for something that, as I've mentioned before, is a very rare diagnosis. But what a delight to be able to share this space with so many people who are so invested in our patients.
I want to thank you all for sharing all those amazing resources. This is incredibly helpful to the patient community. As we begin to wrap up, is there anything else we haven't touched on today that you feel is important for the MDS community to know?
I think the most important thing is that being well informed, getting the information you need is the best way to keep yourself safe and to be the best possible patient. There is no question that is off the table. You should feel comfortable asking questions and getting the information that you need. And all of the organizations represented here can help you in that process with the information and also help you with figuring out what the questions are you should be asking.
I appreciate you coming together and discussing an extremely important topic with us today in hopes of providing MDS patients with answers and insights during this time. We look forward to collaborating in the future and continuing to build this community with our partners. Thank you.
Thank you.
Thanks, everyone.